Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, managing ADHD and ODD when they occur together, attention deficit hyperactivity disorder, ADHD, and oppositional defiant disorder, ODD, are often comorbid, occur together in the same person. ADHD is a neurodevelopmental disorder marked by impulsive and hyperactive and/or inattentive behaviors. ODD is a behavior disorder marked by behaviors that are uncooperative, defiant, and at times hostile. /r/n/r/n addressing comorbid ODD and ADHD is a unique challenge for children and their parents. Treatment may involve a combination of medications, behavior therapy, and social skills training. Following a consistent routine and using calming techniques can also be helpful. /r/n/r/n This article explains why ODD often occurs with ADHD, how the conditions are treated and managed, and coping strategies for parents and children. /r/n/r/n Laura Porterrnrn Research suggests that as many as 1/3 to 1/2 of children with either ADHD or ODD also meet the criteria for the other. /r/n/r/n While it isn't entirely clear why ADHD and ODD occur so frequently, researchers have identified a few overlapping risk factors, including /r/n/r/n adverse life events are the strongest risk factor for both conditions. /r/n/r/n ADHD is a neurodevelopmental disorder, meaning that it affects the growth and development of the brain. As a result, ADHD can lead to challenges with language, emotions, behavior, self-control, learning, and memory. /r/n/r/n ODD is a behavioral disorder, meaning it is characterized by persistent patterns of behavior that violate social norms or rules, impair a person's functioning, and disrupt the lives of others. /r/n/r/n The two disorders cause different symptom profiles, some of which can overlap. /r/n/r/n Children with ADHD often feel frustrated quickly, which can lead to angry temper tantrums, especially in response to boredom. Children with ODD are also prone to throwing tantrums, but those tantrums are more likely to become physically aggressive. /r/n/r/n When paired with impulsivity, which is characteristic of both disorders, a child with ADHD and ODD may have angry outbursts in response to boredom that may lead to aggression. The child may refuse to comply with requests to apologize or blame others for their own mistakes. /r/n/r/n Other examples of how ADHD and ODD manifest together include /r/n/r/n While occasional argumentativeness and irritability is normal for most teens, a child with ODD and ADHD will start to test boundaries from a much earlier age, as early as preschool in some cases. /r/n/r/n Some symptoms of ADHD in children include /r/n/r/n ADHD begins in childhood, but often persists into adulthood, though the symptoms can change over time. /r/n/r/n Adults with ADHD may /r/n/r/n Odd symptoms in children include /r/n/r/n As with ADHD, ODD is usually diagnosed in childhood, typically in preschool, while ADHD is diagnosed primarily in school-aged children. ODD usually resolves by age 18 but can persist into adulthood both on its own or along with ADHD. /r/n/r/n Adults with ODD may /r/n/r/n The exact causes of ADHD and ODD are not known, but both are believed to have a genetic link and are likely influenced by multiple environmental factors. /r/n/r/n Several studies suggest that ODD may be caused by parental influences such as insecure attachment, harsh parenting, inconsistent parenting, or abuse. It is important to note that while this correlation exists, children who have a loving, supportive, and consistent home environment can also develop ODD. /r/n/r/n ADHD and ODD both have distinct criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. While they may occur together, they are diagnosed separately according to their individual criteria. /r/n/r/n diagnosis typically begins with a visit to a healthcare provider who can perform a physical exam, ask about symptoms and family history, and make referrals as necessary. /r/n/r/n ODD is usually diagnosed in early childhood. ADHD is typically diagnosed by age 12, but it's not uncommon for adults to be diagnosed with ADHD that was missed in childhood, particularly in women. /r/n/r/n treatment often involves addressing each condition separately when they occur together, but there can be overlap. /r/n/r/n children with comorbid ADHD and ODD are at an increased risk of developing anxiety, depression, conduct disorder, and personality disorders later in life. They are also more likely to engage in aggressive or criminal behaviors than people with ADHD or ODD alone. Starting treatment from an early age reduces these risks. /r/n/r/n medication is not effective for treating the core symptoms of ODD. For someone with ODD and ADHD, medication is typically prescribed to reduce the inattentive, hyperactive, and impulsive symptoms of ADHD. /r/n/r/n The first-line treatment for ADHD is stimulant medication, such as /r/n/r/n when ODD occurs with ADHD. Stimulant medication can help manage ADHD symptoms, allowing for more effective treatment for ODD using other measures. /r/n/r/n behavior modification is an effective treatment for people with ADHD and ODD, especially when used in conjunction with medication to treat ADHD symptoms. /r/n/r/n The goal of behavior modification is to learn or strengthen positive behaviors and eliminate ones that are unwanted. It also involves forming developmentally appropriate consequences for misbehavior. /r/n/r/n behavior modification may be carried out by therapists, teachers, parents, or other caregivers. For children younger than 6, behavior modification guided by parents, known as behavioral parent training, BPT, is recommended before prescribing ADHD-specific medication. /r/n/r/n behavioral parent training is widely considered the first-line treatment for children with ODD. However, the main criticism of BPT is that it does not directly identify, address, or engage with the underlying emotions that lead to misbehavior. /r/n/r/n individual, family, and peer group therapy can be helpful for ADHD and/or ODD. This can include the following. /r/n/r/n A 2023 study published in Frontiers of Psychology showed that combined yoga and music interventions on a daily basis can be an effective treatment for children with comorbid ADHD and ODD. /r/n/r/n Other practices that have a calming effect on children and adults include /r/n/r/n Parenting a child with ADHD and/or ODD can be daunting, but there are effective strategies. /r/n/r/n Having a safe space where children can go to calm down without hurting themselves or others can help them express their big emotions safely. Try to ensure this space is used for self-regulation, not punishment. Recognize when you are reaching your limit. Allow another adult to step in if possible, or make sure your child is safe and walk away for a moment to calm down. /r/n/r/n ADHD and ODD are separate conditions but often occur together. ADHD is a psychodevelopmental disorder that causes hyperactivity and impulsivity and/or inattention, while ODD is a behavior disorder that causes defiant, irritable, and hostile behavior. /r/n/r/n medication is often helpful for ADHD but rarely used for ODD alone. Several forms of therapy are useful for both disorders. Early intervention is associated with more successful treatment. Routine, consistency, clear expectations, and consequences are key to parenting children with ADHD and/or ODD. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.